You're listening to 90.3 WHPC, the voice of Nassau Community College in Garden City, New York. I'm Bill McIntyre here with Jon Gallo, bringing you news stories about Long Island and about Long Islanders. Once again, we're very happy to be joined by Nassau County Executive Laura Curran. Hello, Nassau County Executive Laura
hello
Curran.
there. I didn't know that was my cue to say hello. Hi.
Hi there. Thanks for
How have you been? Busy, I'm sure.
I've been great. How about you?
Pretty good.
Yeah, okay. Watching the news and things like that. So, it's a double-edged sword. You want to stay informed, but you also want to stay sane. Sometimes it's tough.
I think you should start a new cable news network when you want to stay informed and you want to stay sane. Tune in.
Hey, can I use that soundbite?
I think you would get a lot of people tuning in.
Yeah. Oh, yeah.
Yeah, but I don't know if I could deliver.
That's the thing. That's the challenge.
Because when you're really informing people, you got to tell them things that they don't want to hear too. So I don't know.
Yeah,
but it's a good idea. Huh? I'm going to think about that.
You could do it in a calm way. You could deliver difficult news in a very calm way.
I think so. I think, like I said, no matter how much terribleness is there, if it's delivered in a little bit more of a kind of way that soothes you, hopefully it blunts some of that kind of pain from whatever the content is. But I guess to that point, I know that we've had you on plenty of times throughout this pandemic, and we all are happy that thankfully things are still much better here than they were at the peak during the pandemic. But that said, as your office, I'm sure the Health Commission, everyone is following and working on directly that there have been some increases in the infection rate. The vaccination rates seem to have somewhat leveled a bit, and there are some continued concerns about the Delta variant, which I know we've spoken to you in detail about in the past. So can you just catch listeners up to speed? I know there's a lot of moving parts, as there always are with this, but kind of what the latest for residents out here to know is.
Sure. So we're all seeing the Delta variant. Our positivity rate has come from about 0.3% to about 2.6%. That's where we are now. We are seeing an uptick in hospitalizations. The good news here is that in Nassau County, most of our people are vaccinated. We're up to 82% of people 18 and older vaccinated. 96% of people 65 and older are vaccinated. We know that's the most challenging group when it comes to COVID. They have the worst impact, older folks. Yep. So we are really pushing more vaccine. We have a student vaccine initiative. We're working with the village of Hempstead and Northwell. We have it sited at Kennedy Memorial Park, right in the village. That is 5 days, started on Tuesday, and the last day will be on Saturday. Still free, immigration status still irrelevant, and you can do walk-ins. You just go to our website for the hours. It's pretty much all day long. But some people are making appointments, but a lot of people are opting just to walk in. And actually, we have seen an uptick in our vaccine distribution. More people are interested now reading this news. And I think, our residents, we're number one in the state in terms of vaccination rate. Of all 62 counties, we have the highest percentage of vaccination. And I think our residents realize why this is important. We want to have a normal school year. We want the kids to come back to community college and regular school, K through 12, and our other universities and colleges normally in September. We want to continue this economic rebound that we're enjoying right now. And vaccine is really the key. Now, is it 100%? No. Is anything 100%? No. It's like birth control. It's like, putting on your seatbelt. It gives you a measure of confidence. It mitigates the risk. So you have less, if you are vaccinated, you have less a chance of getting the virus, significantly smaller chance, and significantly smaller chance in that subset of getting very sick and dying, going to the hospital because of COVID. So we're really encouraging people to take advantage of this free vaccine. And when you think about it, about less than a year after the outbreak, we had a safe and effective vaccine. If you don't trust me, talk to your local your personal health professional, someone that you trust, and see what they say. And if it's the right time for you, this would be a great time.
That is definitely an important message, and certainly the county has been doing everything they can to get people to be met where they're at in terms of whether you're a student, in terms of whether you're a senior, the at-home vaccination programs and all the other things we've talked to you about that certainly have made a big difference, undoubtedly here on Long Island. That said, I do know that the state did commit, I believe, to spending about $15 million to target about 117 zip codes throughout the state, which include about 21 on Long Island, and I know some of them, I think including Elmont, were ones with low vaccine rates. How is that money going to help those efforts on already what you were doing here at the county level?
Yeah, so it's going to get more vaccine in those places where the vaccine rate isn't as high as it should be, and we really welcome the state's help here to get those resources to get that targeted vaccine happening. So yeah, I think we had about 4 or 5 zip codes in Nassau County. So even though we're leading the state, we still have some trouble spots. We are finding in our African-American community, our Latino community, among young people, teenagers, the rate is not as high as we would like it to be. We are outperforming in all those communities, according to this, when you compare it to the state average and the national average, but we have more work to do. And the CDC has recommended increased vigilance. So I'm asking, everyone within the sound of our voices to make a personal risk assessment. Just assess your own personal risk, what you're comfortable with. If you feel the need to take further precautions, I would encourage you to do that.
Yep, that makes perfect sense.
I've told most people that I know that get your masks handy, keep them handy, because you never know when you enter an establishment what the rules are going to be now.
Right. And if you're coming around people who are immunocompromised, or you've got young kids in your family or in your community who can't get vaccinated because they're 11 or under, you got to take special care with those people.
Yeah.
Definitely. And to that point, though, that CDC mask guidance update, I know, there was mostly talking about the places where it did have higher rates, but it did also, I think, include places, I don't know the exact term, maybe substantial infection rate, which I know included most of New York City and technically, I think most of Long Island. So is that going to change anything practically? I know you've been a big advocate for trying to get, schools to stay open and in theory to, see, that children learn, in person, but there are always those concerns about whether or not they wear masks and things like that. So has that, kind of trickled down, and is there, kind of a full fleshed out on what the, county does in response to that?
So we're talking to our federal partners, we're talking to our state partners, we're looking at all of the data. And, at this point, we're asking everyone to make that personal risk assessment. Take care of yourselves, take care of your families. Now, I'm not the boss of the schools. I can't tell them what to do. So unless I somehow declare a state of emergency, we don't know. It doesn't look like that's going to have to happen. So I am optimistic that if everybody's smart, people get that vaccine, we're going to be okay, that this is going to be temporary and we're going to move beyond this. But it's going to take everyone to be smart.
Okay.
Oh, boy.
I know. Did you think we'd be having this conversation again?
No, you know what? No, but I'm glad that the one thing we did say is that if the numbers started to climb back up, we warned everybody. If it doesn't stay low like it has been, everything's going to come back that we've been going through.
Right.
And we're on that precipice right now, and it's up to people. Yeah. Really, it's up to us to decide whether we want it or don't want it, because it's obviously what we do. Yeah.
But to that point, I know Bill and I were discussing, and people who see the news, that there's been discussion about New York City, their workforce, especially the public-facing health workers, and then also state employees, being more or less either mandated to take the vaccine or potentially submit to weekly testing. Is that something that you think is going to be considered at the county level in Nassau, or is that something? What are your thoughts on that, I guess?
I'm certainly looking at what New York City is doing. I'm looking at what the state is doing. We do have a lot of employees that deal with the public. We have 7,200 employees in law enforcement and social services and all kinds of departments that deal with the public. So, I am heartened by the fact that our vaccination rate in Nassau is so high. That protects so many of us, but, we're going to have to look at everything.
Okay. Yeah, that Makes perfect sense. Like you said, no reason to be set in stone when sometimes, the ground beneath us shifts in ways. And I do know, so I want to point out that we had talked to Commissioner Ryder a number of times in the past. I don't remember exactly when it was, but talking about, the rates in NCPD and some of these workforces where, they are a bit younger and as he described them, healthier, where, it's a little tougher to get them to maybe come to get the vaccinations. But do you think that that'll change again with time now that we see that we're kind of trying to get the last folks on board?
I hope so. I encourage everyone, if you're on the fence, if you're skeptical, the internet is a great place. There's a lot of good information on it, but it might not be the best place to get your medical information. So go to a healthcare professional that you trust, get their advice. I'm not saying listen to me. I'm not a doctor. I'm not going to prescribe something to you. Talk to your healthcare professional. I'm vaccinated. My entire family, all 3 generations, completely 100% vaccinated. And it gives you a certain confidence. You don't have to worry as much.
Yeah, right. That is definitely fact. So, okay, that's good. And, thankfully, for now, that's hopefully all we need to really delve into the, COVID side of things, because this will still be a part of the conversation. And that is part of why I know you had an event I think we discussed with Senator Thomas and the Delta variant when it was spreading in India and seeing how these global pandemics are not, kind of kept to one specific geography. So thank you for all that information for our listeners. Of course, we always urge you to recommend on following the county executive's health department and all the other medical professionals, including your own personal ones, in terms of the latest information on COVID. So that said, maybe some other just positive things. I know there were some grant funding kind of announcements and some more money coming for nonprofits as well. But also, am I correct, for ShotSpotter? Was there some additional funding that, since we just mentioned the police, that was being allocated to that program? Is that something that is correct?
That I would have to get more information on specifically about ShotSpotter, but I can talk about the nonprofits. So yes. From the American Rescue Plan money that we have gotten from the federal government, we're allocating close to $18 million for nonprofits, especially those nonprofits that worked with folks in COVID. And when you think about it, we have quite a robust nonprofit network that deal with, say, domestic abuse. We did the announcement yesterday at the SAFE Center that deals with victims of domestic abuse and sex trafficking and substance abuse, youth services, senior services, veterans agencies, veterans nonprofit groups. So this money was approved by the legislature. So we're ready for folks to apply, nonprofits. So if you're a nonprofit that already is contracted by the county, you're going to get some money. And if you are a nonprofit that doesn't do business with us, but helps people, especially in vulnerable communities, you're eligible to apply. And they can go to our website. It's nassaucountiny.gov/boostnassau. That's our portal for all things American Rescue Plan. So help for small businesses, help for nonprofits. That's where we're funneling all of these applications through.
Great. Yep, that's important information.
Could you repeat that again?
Yes, Nassau. It's a bit of a mouthful. It's Nassau, Nassau County, NY, all one word, nassaucountiny.gov/boostnassau.
Beautiful.
And it's very easy to use to figure out how to, whether you're a business, if you need rental assistance, help for nonprofits, all of these programs, these grants, these loans, they're all there.
Awesome. Yep, that's an important tool, definitely, for anyone out there listening. You can always contact your local electeds, too, if you have any more questions or, kind of concerns with that process. But like the county executive said, it is pretty straightforward, thankfully. And in terms of some other big news that, has been announced recently that impacts the county is regarding the settlement for opioid kind of damages, we'll say, that was kind of met, I believe, with a lawsuit from the Attorney General's office, and Suffolk County, other parts of the state were involved in it. And I believe that there was about $115 million that was reported that will be coming to Nassau County for folks impacted. Could you tell listeners more about that and what that means for them potentially?
Sure. Yeah, we're expecting up to $115 million from this settlement. This was a really big deal. This is one of the first of its kind in the country. And we hope other municipalities use our strategies for getting this. When we first entered into this lawsuit, I promised that we would fight as hard as we could these pharmaceutical companies that really peddled poison into our communities and got people hooked on opioids, hold them accountable and make them pay. And this money will go towards treatment, towards education, towards prevention. So while we can't bring back lost or the folks that we've lost, loved ones that we've lost, and while we can't undo the damage that was done and the people who are still with us and the upending of their lives, we can help them, and we can also prevent future people from getting hooked. And, the fact that these pharmaceutical companies, it sounds to me, knowingly knew what they were doing, getting people addicted, they had to pay. And I'm really proud of our legal team, our acting county attorney, John Chiara, and our team and our outside counsel as well. It's a firm called Napoli Shkolnik. They really fought. They did a great job. We were together with Suffolk County, and it goes on. The battle still goes on. There are still more defendants that we're dealing with. So we did see, it's very sad to say, we were making great progress with opioid overdoses before the pandemic. The pandemic hit. We're seeing those numbers start to go up again. It's sobering, no pun intended. It really is sobering news. So we've re-energized our efforts now that we can actually be with people again in prevention, education, treatment, and letting people know what the dangers are, how to avoid them.
Yeah. Yes, exactly. That is essential, knowing how many people either directly or indirectly know someone who was impacted by the devastating epidemic of opioid abuse in our area. So certainly it's good to see that there is some accountability. I know we've reported and spoke to other reporters too in the past from Newsday about additional terms in regards to Purdue Pharma and the Sackler family not being able to participate in that space. To your point, Executive Curran, of them potentially having kind of acted in a malfeasant way or with some knowing of how harmful their strategies of trying to push these in a sense to patients were. So that's certainly important. But is there like an open portal for that yet, or is that something that's going to come down the line in terms of how do people kind of apply for those types of funds? So
we have to we were working with the legislature, and they have to approve the use of the funds, and then we'll have more information on how it can be accessed. So we're going to get it before the legislature. They're important partners in this process. So like everything in government, there's a process, and we're going to follow the process.
Yes, sometimes lumbering, but yes.
Often lumbering. Often lumbering.
Fair enough, but I know you'll be on top of it, and I'm sure the local reporters out here as well will be tracking that along with the families and advocates in that space. So, okay, that is good to know. And certainly, like I said, we want to see the positive, the negatives, and then the silver linings on that accountability. So maybe some other issues that I know that are still being talked about right now. I know Long Island always is a commuter kind of based area, and we all spend probably more time than we would like on the LIE, the southern state, the northern state, etc. But it seems that there's been a little bit, at least from the reporting, of either a spike or a kind of renewed call for trying to do more about these terrible tragedies of car accidents. We know it's a constant problem and it's always going to be there, but what I guess are you hearing? I know some of the state senators and other electeds were talking about maybe trying to get more enforcement, maybe by state police, or what do you think in terms of Commissioner Ryder and everyone else can do to help with this terrible problem as well?
Yeah, we've been speaking with the police commissioner about this, and I'm hoping to announce something next week. It seemed like over the past week there has been one after another terrible accident. Often either irresponsible driving or drunk driving. That horrible crash that killed 5 people, those young people from Nassau County, from Manhasset and Garden City, and the Uber driver from Suffolk. I mean, it's just devastating. And I don't know, this is me anecdotally, out on the roads. It seems like people are not being as careful as they were before. I don't know what happened. But it's just a lot of irresponsible driving. And as much as we talk about it and step up enforcement for drunk driving, unfortunately, we see far too many of these kinds of, I don't even want to call them accidents, just tragedies. So I want to remind everyone, if you're on the road and you're drunk or you're high or you're somehow intoxicated, we're going to get you. We have stepped, we're going to step up enforcement as we need to. And there is true accountability here. So if you're thinking about it, don't do it. Make a plan before the first sip. Make that plan when your judgment is still solid.
Yeah. One of the things we've talked about on the show is that, someone who gets involved in that kind of thing, it can cost you north of $10,000 as far as just the financial hassle that you're going to get into.
Exactly.
Now, you can also have your car taken from you.
Not to mention you'll feel like a jerk for the rest of your life, knowing that you killed someone or maimed someone. You just think about that.
Yeah, I think if anyone read the quotes and comments from this, one of the people involved, I believe, in the car accident that you were speaking about, in terms of how they kind of wish that it was them who, perished in that accident. I think if you read that quote every time you want to go get into the car after drinking, you might, think again a bit wiser, hopefully. So certainly, we don't like to see these tragedies at all. And I know a lot of this is obviously out of the control of any one particular individual, but in terms of, I think to your point, County Executive, maybe seeing some anecdotal, and I know reporting about people who's during the pandemic, when there weren't so many people on the roads, they might have been a little bit more aggressive, but now that people are kind of coming back to the roads, the last thing we want to see is, more people hurt.
I'd like to know how effective it was, but you remember the days where they would put wrecks on display so that when you were driving down a highway, you had a chance to take a look at what happens to a car when it, if it works, let's do it again.
Yeah, it's not a bad idea. That visual, you can't get that out of your head once you see it.
Yep. True. Obviously, well, we need something to boot people in the, to get it to happen. It's tough.
And the tragedy about these young people is that they did the right thing. They took an Uber. They were responsible. They listened to what we've all been telling everyone. And then it's some other driver who crosses over the center lane at speeding, above the speed limit. And this is what happens. That's the scary thing is a psychological thing. You send when your kids get in their car and they drive, you tell them to be careful. Mm-hmm. And when you realize what's going on, the truth is they could be careful every time they got in the car, but it's going to be somebody else. Mm-hmm. That's there's no control over those things happening.
Unfortunately, but that's what, we try to deal with these social problems and do what can be done with policy. But like I said, certain things are unfortunately a bit of out of control. Just maybe in the last minute or two we just have here with you, I do know a lot of people were also following kind of not necessarily unimportant, but a little bit lighter in terms of these shark kind of sightings that we see. I know a little bit of a much lighter story was out in Suffolk with these bull sightings, and that became a whole spectacle for Long Island. But
did they get that bull? I don't think they got the bull.
I don't think so. I still
I think he's still running around out there. Yeah.
He's having a ball out there.
Exactly, right. Having a good life out there on the lamb. But point is that exactly right, Dadush. But for the shark sightings, what I was fascinated with, I know this is something comes with the territory and being a South Shore kind of lifeguard too. An extent, but there might be some more frequency. But the drones, I didn't realize how integral they were in trying to kind of survey the area. So if you just tell folks maybe a little bit on how you guys are kind of dealing with it, and they can feel safe, hopefully in the waters if lifeguards say it is such.
Yeah, so I want to just preview my comments on sharks to say, don't freak out. It is safe to go in the water unless it's not, and then you'll find out. You'll know. So we last summer, we had many more than normal shark sightings. It started in late July. So starting late July this year, guess what? We've already had, 5 or 6 shark sightings in the past week, all along our South Shores. So we have, like we did last year, we enhanced marine patrols. So those are the PD boats, police department boats, and also the helicopters from the Aviation Bureau, the aviation unit in the police department. And in fact, I was out walking down the boardwalk just for a little bit of exercise yesterday evening in Long Beach, and there went the helicopter. I was proud of our guys. And so if there is an issue, if there is a danger, if there is a sighting, they will immediately, and drones are very helpful too, will immediately communicate to the lifeguards in the municipality. And if you hear that whistle and you see that arm summoning you back to shore, it's happening for a reason. So pay attention. And something interesting, if you're wearing jewelry, you might want to take it off before you go swimming, because to a shark, it can look like scales, and that can make you look like a snack. So they're not really interested in eating you, but if they think you're something else, you may be a little more tempting.
Yep. don't want to look like a too close to them. So, okay, that makes perfect sense, of course. And, definitely we just want to make sure we get as many people out to the beaches and enjoying those staycations as much as they can. So,
right. Go swimming. It's fine. I'll go swimming. But just, if they say get out, I'm getting out.
Exactly. So, yeah. All right. I guess, that's pretty much it on those. I just maybe the last thing, just because I know the last time we spoke to you, the Islanders were still in the playoffs, and unfortunately it didn't go exactly how we wanted to, but, it certainly was a great run to close down the barn once and for all. And I know Belmont seems to be going very well and is certainly looking like it's ready for the task for another playoff run next year, or this year rather. But this last thing, I know there's some Nassau County folks who have connections to here home, rather, but are in the Olympics. So just maybe you just talk about why that's something to take more pride in, and some of those people and kind of their stories and how they impact Long Island.
Yeah, this is really exciting. So we had a silver medalist from Wantagh, Capobianco, and Anthony Capobianco, and his parents are both retired Nassau County cops. So that's a good hometown story. And then there's Christine O'Brien from Massapequa, a rower. There was a big watch party out in Massapequa Park last night, and Sue from Syosset doing, they're making us all so incredibly proud, these young people. So we're cheering them on, even though it's 13 hours behind or above or whatever it is. But it's really exciting, and I'm really proud of our young people.
Definitely. That's a great point to end on, as always. Pride in the youth. And also, I believe even the owner of the Islanders, they are directly related to Ledecky.
That's right.
Of course, is a world-renowned swimmer and very important Olympian, in our delegation. So certainly, if you're an Islanders fan or if you're just a fan of Long Island, there's something for you to at least, care about in terms of the human interest side of the Olympics. So thank you so much, County Executive, for all the other information that you've provided. And we look forward to, of course, speaking with you again down the road.
Gentlemen, it's always a pleasure. Thank you for having me.
And go for it, Bill.
Okay. And now we're very grateful to be joined by Northwell Health's Senior Vice President and Director of Critical Care Services. As Director of Critical Care Services, Dr. Narasimhan works with all of Northwell Health's clinical, operational, and critical care leadership to help drive greater patient outcomes and standardization across the health system's critical care services and related operations. Well, Dr. Narasimhan, thank you for joining us. We know you're busy, and we really appreciate you taking the time out to speak to us.
Most definitely. So we're particularly glad to have you on today, because we know that everyone on Long Island is happy that things are much better than where they were at during the peak of the pandemic, but still, nevertheless, persistent concerns remain about a rebounding COVID infection rate, increased prevalence of the Delta variant, and the stalling vaccination rates nationwide, which have now resulted also in updated CDC mask guidance. So we spoke to County Executive Curran about a lot of these issues as well in the county's response, but we certainly wanted to hear your perspective, being on the front lines and so directly involved with the struggles and battles to keep everyone safe here on Long Island dealing with this pandemic. So thank you again for joining with us.
Yeah.
And you're welcome. It's my pleasure. I can give you a sense of what's going on right now in our hospitals and what's been happening. So we had our big wave last spring. We had a smaller wave in the fall. And then we had a little bit of a period of quiet where our hospital numbers went way down across our health system. In the last 2 weeks, our numbers have doubled, and we're seeing more patients. Not a tremendous amount, but enough. The ones who are coming are mostly unvaccinated patients that are sick enough to end up in the hospital. We are seeing a few vaccinated patients, but the majority of them are immunocompromised cancer patients on chemotherapy or patients on steroid therapy at home, or other reasons why they're transplant patients, reasons why they didn't respond well to the vaccine. We're not seeing a lot of vaccinated, healthy people coming into the hospital.
Okay, that's definitely good to know. I know that that's an essential part of the reporting on this issue, that the spiking of the infection rate is, like you said, very highly correlated with the level of vaccination in an area. So to that point, do we know in terms of, I guess, percentages? I know there's some funding coming from the state, even because some areas of Long Island had some lower vaccination rates, but is there hard data right now on what percentage, again, is vaxxed versus is unvaccinated? I know it's very small, but is that available, that data?
It's really very dependent zip code to zip code, and it changes across Long Island and across the tri-state area. I think approximately 60%, somewhere between 60 and 65% are vaccinated, but it really does change zip code to zip code.
Okay, yes. No, I apologize. I meant hospitalized, rather. Who
hospitalized? Yes. So 90% of the hospitalized patients with COVID are unvaccinated. There's about 10% that are vaccinated, and those are all immunocompromised patients right now.
Okay, that makes sense.
Okay, so that explains why, because all we hear is the soundbite that says vaxxed people are also getting this, but those would be immunocompromised cases.
Correct. Okay. And we don't think they responded adequately to the vaccine, or and have other reasons to still get COVID.
Understood. Right. Okay, and certainly, we know that care has changed for patients as well. How again are you and your colleagues dealing with the folks who do unfortunately fall ill still to COVID right now? How different is the care kind of? I know the context is a little bit different in terms of the volume, but in terms of the actual care practices, how has that kind of changed over the last year?
So that's a good question. It has changed a little bit. The first wave that we have, we really were very concerned that that COVID was going to be spread throughout the hospital. We didn't want anything aerosolized in the air. We didn't know how good our personal protective equipment was going to be, where our N95 is going to protect us or not. So we really were intubating patients very early, as soon as they needed more than a non-rebreather, 100% non-rebreather, we were intubating them. We've now found that we can safely use non-invasive ventilation, high flow oxygen. We're doing a lot more of that now before we need to intubate patients, trying to prevent intubation. Intubation, we know, is a more severe form of ventilating people. We do it when we need to, and people do recover from it. So I don't think people should be afraid of that. But I do think that if we can avoid that by using different kinds of oxygen and non-invasive, we're trying to do that more. We're also giving people steroids. There's been several trials that have shown benefit for that. We're giving them antivirals, remdesivir, early in the course as well. And that's our mainstay of therapy, really. It's just antivirals, steroids, and oxygen as needed to keep them healthy.
Okay, that's good to know. But I think the main point, obviously, is to get vaccinated to lower the probabilities of ever being hospitalized to need these types of interventions. Although that, like you said, they have now advanced to a slightly different regimen where they were at the beginning of the pandemic. So that's good to know. In terms of, I guess, also dealing with kind of the what is called COVID fatigue, in terms of people who are coming into the hospital who are unvaccinated. Are they reporting, that they, for whatever reason, just didn't think it still was an issue? Because we've had plenty of time. We all know what this is, anecdotally or, in some form of data. Is there any kind of, common reason why people that you hear are not getting vaccinated who wind up hospitalized?
So this is so frustrating for us because we see patients, young people. We have a 30-year-old man who's dying from COVID right now, and it's so frustrating because we know all of this is preventable, and people just don't want to get vaccinated for the main reasons that we hear is that this is new technology and it hasn't been tested enough. We also hear that the vaccine is not yet FDA approved and they won't take it unless it's FDA approved. I think that getting COVID is so much more of a gamble. You don't know what's going to happen, and it may be that you're fine, or it may be that you're not fine, and you have permanent lung damage. You have permanent problems neurologically, that your cognitive abilities decrease. There's so many long-term effects of COVID. To me, that's much more of an unknown and much more of a risk than getting vaccinated. Millions of people across the United States have been vaccinated, and we don't see those side effects from vaccination. It's rare. It's very few and far between, and the vaccine overwhelmingly seems safe. So it's frustrating for us to see patients when they come in super sick that we could have prevented this from happening.
Definitely. We know that you've been on the front lines and you're involved with the pulmonary division and have been involved with those tough decisions with the ECMO, patients as well. So certainly people should really heed, your opinion and your colleagues who, were on the front line. So, Bill, I know you had some additional questions. I know we've talked about some of the other things like the mask guidance and some other things. So go ahead.
Yeah. Today on News 12, they've been reporting that the variant is as easily spread as chickenpox. And also, I heard they were talking about some kind of brain effects in older people. And we were talking before the show about there's a test that's been going around. I don't know if it was a Facebook thing or whatever, about people smelling the peanut butter and being able to differentiate between their nostrils and their ability to smell this peanut butter as a test for Alzheimer's. And then we have the coronavirus comes along and people are losing their taste buds and losing their ability to smell. And that's kind of those mechanisms. Is this affecting people that way? And
so what we do know is that you definitely have a problem with your taste and smell. It's one of the first signs that warn you that you have COVID, is that you can't taste anything, you can't smell anything. The virus affects parts of the brain that are involved with the ability to smell. I know for a fact that there are neurological effects of the virus, and patients feel this brain fog. They're unable to think clearly. We saw a lot of young patients have strokes with COVID, when we had big numbers of patients. So there's no question that there are neurological effects, that it does affect your ability to think. They think this long term. I saw a study that came out in the Lancet that showed that long term, 6 months, a year later, they did IQ tests on people who had COVID, and the number of patients that did scored poorly with COVID was much higher than the number without COVID. So they think there's a correlation long term with the ability to think and COVID. So I think there's a lot of research still being done. We don't really know the answers to it. The best thing you can do is to try to avoid getting COVID if possible, because the fact that there are so many unknowns that we just don't know. We're still seeing patients in our clinic that had COVID a year ago that are now still can't breathe well, still on oxygen. So even that they even though they survived, there's so many long-term effects. So I don't know about the link to Alzheimer's. That hasn't been, I haven't seen anything on that, but there's definitely effects.
Okay.
Yeah. I think that's the biggest thing, is that one of the problems was that as we learn more and more, of course, we would change direction or make another recommendation. And a lot of people use that just to say, oh, they don't know what they're talking about. And we really need to, like our listening audience, we constantly tell them that, hey, we're learning. So, don't react that way. These people are not trying to hurt you. They're trying to help you.
This is a new virus that we know nothing about, and we're learning, as we go along, and that's science. As we learn, we change the recommendations, and nothing's going to be perfect. We don't have the answers every day we learn a little bit more about COVID.
Exactly. Like you said, it definitely, directions come with the data. And to that point, I know you were on record, I think, with Newsday talking about the fact that, you feel that a lot of folks have kind of let their guard down, and that, in addition, that you, I believe, thought that maybe the mask mandate shouldn't have been pulled down by the CDC, which now it seems to be replaced for areas which have, I think, high rates and also, I believe, substantial prevalence of COVID, infection. So what do you think about now that it seems like we're going back in that direction? Can you tell our listeners, what your perspective is on it?
Yeah, I think the Delta variant is extremely contagious, more contagious than previous variants of COVID. And I think there's a new Lambda variant that's coming down the pipe, and, other things. So I think we don't know what's going to happen. We know that people now have been vaccinated for 6 months, and maybe their immunity is not so good anymore. We don't know if people should be getting booster shots or not. So I think indoors, you should still be wearing a mask if you're around people where you're not sure if they're vaccinated or not. I do think that we're not out of the woods yet. And I don't know what's coming down the line. This is all new territory. It's better to be safe than sorry, especially if you live with children under the age of 12 who haven't been vaccinated, or you live with older people who may not have responded well to the vaccine. We have no idea. So depending on what's happening in your home and your risk factors, that should be taken into account when deciding whether to wear it. I would say it's better to be safe than sorry. We don't want to go back to where we were a year ago, and we want to get through this as safely as possible for as many people as we can.
Most definitely. Definitely, that's what we want to see. And
I don't know if has it changed at all. You know, they were saying for a while, if you've been vaccinated and if you got COVID again, that it wasn't likely you could pass that on to somebody. Do we know that for sure? Or
so the new data is saying that even vaccinated people or people who've had COVID who get COVID again seem to be passing it around to people. We're seeing that more. We're seeing families come in, with very short exposures to each other that have given it to each other. Families of 4 and 5 people that only, had a 10-minute car ride together or who had dinner together for a few minutes. We're seeing stuff like that. So it seems that this variant is extremely contagious, and it does seem that vaccinated people are spreading it.
Okay.
And that's seemingly resulted again in this, reissuing of the guidance kind of by CDC and seeing what the city is doing with their workforce, the state in terms of trying to mandate vaccination or testing. Certainly, we look forward to, having you on hopefully in the future to discuss, where things are, and hopefully they keep getting better because people are listening and continue to get vaccinated and do what needs to be done to keep everyone safe here on Long Island and across the country and world for that matter. So thank you really so much for your time. We really appreciate you sharing this information, which is essential with our listeners.
Yes.
Anytime. Reach back out in the future and we can continue with updates. That's fine.
Oh, that'd be great.
Definitely appreciate
Wonderful.
it. Definitely.
Thank you very much.
Look forward to it. Take care. Have a good weekend.
Take care. Have a good day. Bye-bye.
Bye-bye.
You too. Bye-bye.
All righty, Bill.
Yeah.
So certainly a lot of information and
that was that was Dr. I'll let you say it this time, John.
Mangala Narasimhan.
There you go. And she is the Senior Vice President for Critical Care at Northwell Health. So we heard some things, because it was going around, well, if you got vaccinated, you can't spread it to somebody. Well, we just found out that might not be true.
But that's the evolving data aspect.
Yeah, right.
That's where the early data was showing that for the other variants, it wasn't being spread because they weren't as contagious. But again, I am not the scientist or the doctor that, of course, the guest was that we just had on. But I have been hearing, in the press, like Dr. Fauci speak to different shows and talk about the fact that it seems that the viral load in the actual nasal passages with the Delta variant do seem higher. Even in vaccinated people than they did with folks who were on with the other variants rather in the past. So there's a lot of things that we're still learning, and that's the problem with viruses. They are not static. They by definition have nothing else to do but try to kind of do what they do.
Exactly it. They have nothing else to do but to morph and and do their job, replicate and take things over.
Sometimes simple but complex organisms cause a lot of harm, but thankfully there are good people like her and a lot of the folks at Northwell who are, really trying to grind through this and pull people kicking and screaming to hopefully a safer time. Like I said, with vaccination and with people, practicing the care that needs to be practiced. So, all right, we will certainly continue on that issue for better and worse, down the line. But I know we have some other news too that we wanted to get in to just to get some updates. Across.
There's actually a little bit of a what to know section here in Newsday from Thursday's paper, and all New York State employees must get vaccinated or tested weekly by Labor Day. That's according to Governor Andrew M. Cuomo. He announced that on Wednesday, and all patient-facing healthcare workers in state-run hospitals must get the COVID-19 vaccine by that day. And then New York's local government should consider mandating vaccines for their workers, Cuomo said, and school districts should prepare to use tougher mitigation efforts, including mandatory shots for teachers, if the COVID-19 numbers keep rising. Now, that's something that we always said when we talked about this. Everybody was applauding the numbers going down, and of course we were too. But no matter what rules they came out with, said, just remember, if that number starts going back up, all bets are off. And here we are.
Yeah, no, that is the exact, kind of scenario we did not want to see. Nobody wants to be right and say, I told you on these types of issues. But certainly, like I said, definitely we're seeing it in other states. Like you said, we're seeing it in this state and city of New York. We talked to County Executive Curran. She says she's considering it. The federal government says, I believe now all military personnel and additionally federal contractors even now are going to need to submit to testing or vaccination. So it seems that, the just ask and just, try and all these kind of more passive methods have been somewhat exhausted. So it's not surprising to see governments try to do these more kind of mandated policy prescriptions for the folks that they can do it for. But the thing is, obviously, the public space, the private workforce and private companies have different kind of abilities than the government does for their workers. So that's still going to be another part of the question. But
So, there's also we didn't talk with the doctor about it, but we did a little bit. That ECMO, through the extracorporeal membrane oxygenation. Some folks think that, if I didn't take the vaccine and I go without, they can always do that and they can save me. And the truth is,
only that,
there aren't enough facilities to let everyone avail themselves of that kind of treatment. You would have to go through quite a few steps, and they would have to realize that this is, you kind of hit the dead end, and this is the last resort. But if there isn't a free bed and the equipment that is needed to do this isn't available, not going to happen.
Yeah. That's just a math problem. So certainly, like I said, hopefully the math works better for everyone. Nobody wants to see anything, close to what we saw at, the peak of this problem come down the pipeline. So like I said, do what you can, keep trying to push for folks, to not coerce them, but to get them to understand that, this is in everyone's best interest. Let's just keep doing what we have to do. So,
the other thing that Newsday quotes, let me give you, is in New York State, 75% of adults have received at least one shot, leaving 3.5 million adults unvaccinated. Starting Friday, New York City residents and employees who get vaccinated at city-run sites will receive a $100 prepaid card as a reward.
Yeah, I think the federal government's going to do something similar. I was hearing they're trying to do. I'm not sure the exact terms of it, but I know for most, who are saying we just want to get people vaccinated by any way necessary, and like I said, get this over with, keep us as safe as possible. That, some of them are in that camp. Others are saying, well, hey, I got my shot. I did the right thing. Why didn't I get $100? Which is a whole other story, but I don't think, is worth the back and forth. I think, like we said, the collective benefit is probably worth more than any debit card really can be. But I just want to get into some other news, non-COVID related. And I know you wanted to get something national, definitely across the airwaves on an update. But I just wanted to mention quickly that Nassau County did announce yesterday, County Executive Laura Curran, that a new grants program, which will allow $50,000 from COVID relief funds to 30 water suppliers and processing treatment centers in Nassau County will be made available. So that's something I know we talk about a lot in terms of trying to keep water safe. It's meant to try to curb and address these emerging contaminants, these PFOAs, these other chemicals that certainly are being bared out in the science that's being done as looking like potentially carcinogen or problematic in whatever way. So just keep an eye on that, and hopefully that money does a good job at trying to address some of these issues, so we don't have to keep having these Grum and Plume stories and these other types of terrible kind of incidents like that. So that's one quick update.
And just to correlate with that, we've also lately been talking about the Liberty aircraft site. If you happen to live in South Farmingdale, or you can go on to this page on Facebook, and it's Liberty Aircraft Site, and you'll see some maps, and there's a certain areas in South Farmingdale, and what they're trying to do is contact people who live in those areas to see what afflictions any family members may have, and they're talking about multiple sclerosis, thyroid problems, Parkinson's disease, things like that. And they're actually putting maps together to try to map out where the concentrations, because when we talk about plumes, we often solely talk about cancer. And I think what they're trying to illustrate is that that's not the only result, that there are other things that are. So it's a work in progress. We don't know, but they are asking people who live in South Farmingdale or know people who did live in South Farmingdale and have since moved across the country to contact the site and maybe share your story.
Yeah, I mean, that's something that, again, we'll see bear out, and, hopefully, I don't know, hopefully, but there may be nothing. It might be just loose correlation, or it might be something that is a pattern that does show and winds up becoming another one of these kind of stories that have to be addressed, kind of at a larger level. But that's something, like I said, to just, consider, if that is something that you experience or know people who do, that there are people kind of looking into that. But I'm not really sure about all the details, and certainly, consider the sources always when it comes to anything that you see on Facebook. That's obviously goes without saying. But it is important to know about these initiatives.
And I give them some credit. I don't think they're not jumping to conclusions, but they are trying to find out.
No, I think that's the key. That's the whole point of science, like you said. Yeah.
Yep.
Exactly.
Yep.
Yeah, like I said. So,
and it's good.
Another
They're
quick
looking.
update. Yeah, that's what you're supposed to be doing. So another point of looking, I know we've talked to Mark Harrington a number of times about PSEG and LIPA and the contract and the failed response to different natural kind of disasters, we'll say, or these storms like Tropical Storm Isaias. So Mark Harrington is reporting that the New York State Assembly will hold a hearing on LIPA's new contract with PSEG that was just reported yesterday. And that will be, looks like, hosted by Assemblyman Steve Engelbright from out in Suffolk County.
To talk it, yeah.
Yep, and that'll be on August 9th at 10:30 a.m. at Brookhaven Town Hall. So there is a link if you want to sign up and register for that to talk about, how you feel. I'm sure a lot of our listeners have some pretty strong feelings about that contract. And about, again, just the service that you get or don't get at times from these companies. So if that is something you're interested in, just check us out on social media at This Week's Long Island News. You can also check out Mark Harrington's page, and you'll find the link where you can register, again, for that event to talk about, like I said, the contract. So
that was a real whoa moment, wasn't it? When...
Yeah, I mean, Mark had made it seem that, it was a decent likelihood that some elected was going to have some kind of public kind of town hall event just because there's so much kind of frustration and outrage from constituents. The question is what comes of it, and does it, manifest into some advocates as they want making it a municipal system, or, is it, again, just kind of let's get all this, vent session taken care of, and they'll try to fight that battle another day. So we shall see either way, but I just wanted to put that on people's radar. So Bill, in the last few minutes, I know that I know you wanted to probably get into some of that national stuff as well. I know that I'll just mention too that the infrastructure package, there seems to be the terms that are being laid out for a likely deal that's been kind of reached in the Senate. I believe it now even has the support of Senator Mitch McConnell, the Democratic delegation. There's still some infighting about, progressives not getting some of the things that they probably wanted. So it's not necessarily a completely done deal, but it's being reported as it likely is, going to be pretty close to this pretty soon. So there's that. And go ahead, Bill. I know.
Yeah, there's a little, the Senate voted Wednesday night to begin work on a nearly $1 trillion national infrastructure plan after President Joe Biden and a bipartisan group of senators reached agreement on major provisions of the package that is a key part of his presidential agenda. I'm not going to read the whole article, but didn't it start out as a $3 trillion package? And we've been...
Yeah, I mean, that's the nature of any kind of debate. The question, I know we've talked with a couple of legislators and other folks about the care economy, which I know has been a big kind of sticking point where, more Republicans at times and conservative kind of Democrats will say, well, that's not necessarily quote unquote infrastructure in terms of bridges and roads and tunnels and stuff. But obviously others make the argument that, again, whether child care support system or the elder care support system and other kind of social kind of network, infrastructure is just as vital, especially things like internet kind of divide stuff. So I don't know. It is certainly, I don't think, a conversation that's going to go away anytime soon, but I think people will be happy that the money likely will be, kind of doled out at some point. It's just a matter of, how much and to whom, as usual.
Well, you know what? It reminds me, it's kind of analogous to talking about $15 minimum wage. By the time you're done talking and actually did something, $15 wasn't enough. I'm hoping that the infrastructure work starts to get done before the bridges start falling down. It would be nice.
That would be nice. Certainly, we see these videos of like roads starting to melt and buckle when it gets so hot, and we all see. Well, I don't know the sites in Long Island, but I know in Queens, people know like the 7 train where like the lead paint chips had been falling off for decades onto the street, and people are cooking food underneath, and hopefully you didn't get any lead with your elote or something like that. Right. So it's a constant thing, and a lot of this infrastructure was built over a century ago now, so no surprise that it's going to need some upgrading. But that's the question of where does the money go? Again, there's this new LaGuardia Airport kind of air tram that some people say, is that really the best place to put the money versus, maybe expanding Long Island Railroad or, maybe Metro North or some other kind of, service. So that's something to definitely watch. And just to that point, too, I believe today is the last day for, I actually don't recall the exact name and title of her role, but Sarah Feinberg, who's at the MTA. That role, I believe she's finishing today, and both her and another individual who was appointed by Governor Cuomo are supposed to be taking over at MTA for Pat Foy, who used to be the commissioner. But this role is supposed to be split into 2 positions now. So there's some back and forth about whether or not that's actually going to be allowed, because I think some of the legislature don't want that. But that's going to be interesting to see how much that's going to impact the future of Long Island, knowing who's at the helm of the MTA and, what its kind of, makeup and structure is going forward.
Interesting.
So, yeah, definitely. So we have just a few more minutes. You got anything else there, Bill, that you see in front of you?
I know that there's this is a local thing. The red tide invades the harbor. That's Cold Spring Harbor. Yeah. Mm-hmm. I guess is that we're basically talking about the nitrogen runoff from.
Well, no, I'm not totally versed on it. I thought it was more of a cyno or like some kind of bacteria based concern as opposed to the traditional red bloom. But it could be that is commonly what is a problem out here. The nitrogen runoff and.
So, they're also saying the researchers really don't fully understand what it's algae. What it might do to the shellfish. So,
the oyster industry,
the whole fishing industry. I would imagine it's compared to when I was a kid. It's definitely distressed.
Yeah, and things like this don't help it any bit. No, of course.
No. It's scary.
It is. It is.
Go ahead. Did you happen to see any of
the hearing on January 6th at the
Capitol Police? Yeah.
I saw some of it, bits and pieces. It certainly was very, we'll say kind of disturbing and dramatic in terms of the testimony. But what are your thoughts on that, Bill?
Oh,
I'm sure you have done.
After I was done, I was really, disheartened. I also happened to get the opportunity to watch the insurrection, I guess, and same thing, But I'll tell you what, let's the clock on the wall, right?
Yeah, we'll have to continue that another day. That's a longer conversation, but certainly, it's important to watch, especially considering where the Long Island delegation stands on that. Representative Swazi, all the way out to Representative Zeldin, Kathleen Rice, everyone, they certainly have a role in that discussion. So I think that's it for that. I'll just mention real quick that for anyone looking for rental assistance, the New York OTDA, they did roll out a new rental emergency relief assistance program kind of application. It's supposed to be streamlined. So if you have any questions about that, or if you're interested in that, check out again the social media page for more information on that application as a landlord or a renter.
Okay, so, and the clock on the wall says it's time for this week's Long Island News to move on out of here. We thank you for joining us. Remind you can catch this week's Long Island News every Friday at 3 p.m. right here on 90.3 WHPC.